The health minister is saying that the country is in dangerous times. As the officials trace 600 more people who have come into contact with the people, like Fred said, he's also saying that there could be more. Well, he said this when the Ghana Commercial Bank donated 100,000 Ghana cedis to the ministry.
Unfortunately, we got to test them positive after they have actually integrated with us, so moved into our communities. Some of them might have interacted with family members, friends, co-workers, and all that. We have a number of over 600 people from interviews with them, those who have been tested positive. We keep on asking them who they had contacted, and I believe they might not even be able to give us the entire spectrum of people they might have met before we detected them to be positive. But for now, we seem to have got close to about 600 people that we are trying to trace, to check on them whether they have already contracted the disease. And I know the number will be more. So over the next few days and weeks, we are anticipating that we're going to have larger numbers of people who are already having the disease. The only thing that I can say now is the fact that we should all be listening to the guidelines and advice that is coming from our professionals and those who are flying our materials and all the radio stations and television stations and people who are discussing COVID-19. Over the last 3 days, almost every day, we get a case. So going forward, we may begin to grow positives exponentially. And that is becoming a very dangerous situation for all of us. Our health system is still very fragile. Even those that have better systems, like China and the US, it's a calamity now. So we may not have a very large number of places that we should treat people. So that is not the area we should misbehave and get into, because it will be disastrous for us. Please, this is not the time when you are passing in front of somebody's door, you say, oh, let me go and say hello to you. Please, no. Those of us in offices, tell those who come to visit us that they should not come again. Because we wouldn't know who you had contacted over the last few days, so don't get closer to anybody. So what you're going to do, if it is not very, very, very critical, please suspend it for some time. A number of airlines have suspended their flights. Some from yesterday, they won't come back. Some from tomorrow, they won't come back. We are still discussing as to what we should do. And I believe when the law is passed, the president will get the necessary power to be able to actually exercise that legal right to stop certain things that we are doing in the country. But some of us are still not listening, and it looks like we are joking with it. Now that we have 11.
Now that we have 11, at the time he said it was 11, after he spoke it had quickly jumped to 16. He also gave an update on those who have tested positive and says they are responding to treatment.
As at yesterday, they were all very stable. Some of them, I would say, are even recovering. There are 2 of them we're treating at home. You don't see any signs of them again. But we may need to do some other tests before we discharge them fully. But so far, we don't have anybody who is critically ill or severely ill. Illness is mild, but you see some of them, and it's like they are becoming very normal people.
How far have we gone with the contact tracing?
Contact tracing so far, we've done close to about 450 people, but we are still tracing. Anytime we test a positive, we begin to track, and we are adding on to the numbers. We, as at 2 days back, we had mapped up close to about 600, but we don't end there. We do some extrapolations and we're thinking that we're looking for potential about 1,000 people. So as the numbers grow, we add on to those that we are contacting. It is working somewhat, but we might not be very, very efficient in that respect. People are also coming voluntarily, to try to give us their, contacts that they did. And I believe we are getting close to something.
We also want to find out from you, how are we keeping track of 600 people that we've already traced?
Those that we trace, we check on them. We ask questions. How long have you been in contact? So when we do the preliminary screening and the person is not showing any, signs of infection, we take him for a normal person. And it's like we don't continue to do nothing with them, but to keep on, because we have their numbers, we keep on calling and finding out their conditions and things like that.
You said we are anticipating more cases. How well prepared are we?
I don't want to be overconfident to tell you that we are well prepared. We are prepared somewhat to take challenges. But when you begin to get massive upsurge, you realize that your preparedness is nothing to write home about. Yes, that is happening in Italy, it's happening in America, it's happening in UK. So I will not use the word well, but we are prepared. These are some of the things.
Well, the script has changed rather rapidly when the health ministry and other health experts told us that we were well prepared for the worst. Certainly, we're seeing the examples from other countries. He says we can't be overconfident to say we are prepared. We could be prepared, but we could easily be overwhelmed. But it is your responsibility to protect yourself and protect other people around you by doing the things that you ought to do. Wash your hand, cover your nose, cover your mouth when you cough.